This medication is used to treat occasional upset stomach, heartburn, and nausea. It is also used to treat diarrhea and help prevent traveler's diarrhea. It works by helping to slow the growth of bacteria that might be causing the diarrhea. This product should not be used to self-treat diarrhea if you also have a fever or blood/mucus in the stools. These could be signs of a serious health condition. Consult your doctor promptly for proper evaluation and treatment if you have these symptoms. This medication is used under a doctor's direction with other medication to treat stomach ulcers caused by a certain bacteria, Helicobacter pylori. Do not use this medication to self-treat ulcers. Bismuth subsalicylate is a salicylate. Salicylates can cause serious bleeding problems when used alone in patients with ulcers. Check the ingredients on the label even if you have used the product before. The manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking K-Pec, make sure to follow the instructions on the package or as directed by your doctor. The dosage is based on your age, medical condition, and how you respond to the treatment. Do not increase your dose or take this medication more often than directed. If you are using chewable tablets, be sure to chew them well before swallowing. If you are using the liquid form, shake the bottle well before each dose and use a special measuring device to measure the dose carefully. K-Pec may react with other medications, so talk to your doctor or pharmacist about how to schedule your medications to prevent any problems. If your doctor has instructed you to take this medication daily, make sure to take it at the same time each day to get the most benefit from it. If your condition lasts or gets worse, or if you are taking this medication for diarrhea and it lasts more than 2 days, be sure to tell your doctor. Side effects from K-Pec are rare. The most common side effects are darkening of the stools and/or tongue, which are harmless and will disappear when you stop the medication. If your doctor has directed you to use this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Vomiting/diarrhea that doesn't stop may result in dehydration. Contact your doctor promptly if you notice any symptoms of dehydration, such as unusual decreased urination, unusual dry mouth/thirst, fast heartbeat, or dizziness/lightheadedness. Tell your doctor right away if you have any serious side effects, including ringing ears, hearing loss. This drug may rarely cause serious, rarely fatal, bleeding from the stomach or intestines. If you notice any of the following unlikely but serious side effects, stop taking this medication and consult your doctor or pharmacist right away. Stomach/abdominal pain that doesn't go away, vomit that looks like coffee grounds, black/tarry/bloody stools. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before taking K-Pec, make sure to inform your doctor or pharmacist about any allergies you may have. Also, let them know about your medical history, including any bleeding problems or conditions like phenylketonuria. If you are pregnant or breastfeeding, discuss the risks and benefits of using K-Pec with your doctor. And if you need to have surgery, be sure to tell your doctors about all the medications and herbal products you are using. And finally, children and teenagers should avoid taking K-Pec if they have certain illnesses or have recently received a vaccine. Interactions with other drugs can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This medication may interact with other drugs such as valproic acid, carbonic anhydrase inhibitors, corticosteroids, dichlorphenamide, and methotrexate. It may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to check all prescription and non-prescription medicine labels carefully, as many contain pain relievers/fever reducers that are similar to this drug and may increase your risk for side effects. Additionally, This medication may interfere with certain medical/lab tests, so it's important to inform lab personnel and all your doctors that you use this drug. If you think someone has taken too much K-Pec and they're having serious symptoms like passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include ringing ears and hearing loss. If your doctor gives you this medicine, don't give it to anyone else. If you're using it for diarrhea, make sure to drink lots of water to avoid getting dehydrated. Talk to your doctor or pharmacist for more information. If you forget to take a dose of K-Pec, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the regular time. Don't take 2 doses at once to make up for the missed one. Make sure to store K-Pec at room temperature, away from light and moisture, and definitely do not freeze it. Also, remember not to keep it in the bathroom and always keep it out of the reach of children and pets. When it comes to getting rid of any leftover or expired K-Pec, don't flush it down the toilet or pour it into the drain unless you've been specifically told to do so. Instead, make sure to properly discard it, and you can always consult your pharmacist or local waste disposal company for help. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.